Hello, this is Dr. David Greene, CEO of the Texas Pain Network. The topic today is 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed every year in the U.S., and unfortunately half overall will not obtain the desired outcome. 10% will actually end up worse than preoperatively. The first consideration is whether or not to seek a second opinion. A second set of eyes may be indicated since it's a very big decision. The second doctor may do multiple things, may recommend the same surgery, may recommend surgery but something different, or may recommend no surgery at all. If you take one patient and ask 10 different spine surgeons, what should be done for this patient, there's a very good likelihood that you'll get 4 or 5 different answers. The second consideration is, have you really tried all conservative options? So if it's not a condition that requires surgery tomorrow or imminently, and it's an elective decision, then you really should try these things. You need to look at yourself in the mirror if something were to go wrong and say, I tried everything that I could. This may include physical therapy treatment, chiropractic therapies, spinal decompression therapy, acupuncture, medication management, and then interventional treatments. The one you see here is a radiofrequency ablation, which deadens these nerve endings around these joints and can provide pain relief for up to 18 months. The third consideration is really to perform a risk-benefit assessment prior to undergoing surgery. No spine surgery is risk-free. You don't have to do a humongous statistical analysis on whether or not the risks outweigh the benefits, but really just give it some consideration because, for instance, adult scoliosis procedures have over a 50% complication rate. It could be anything from infection, bleeding, nerve injury, anesthesia complication, failure to fuse, scar tissue formation. All these need to be looked at. The fourth consideration is to really do a reality check on the potential outcomes. 50% of back surgeries do not end up with the expected outcome. 10% end up worse. Now, for example, if half of your pain goes away, is that good enough? Okay, because it's rarely going to be a home run. Here's an example. The FDA study looking at the lumbar artificial disc, this was done over a decade ago, and basically they compared artificial disc to fusion. When they looked at the two groups a year out after surgery, half of the patients in either group were still taking narcotic medication. Now, they wouldn't be doing that if they'd gotten rid of all their pain, right? So a lot of the time, there's still residual pain. The question is how much is going to be acceptable, okay? The fifth consideration is the timing of the surgery. For elective surgeries, you really can't pick the best time to undergo the procedure. This may be over a summer break, sabbatical, whatever is the most convenient. Do you have some time coming off from work coming up? Rehab considerations for a laminectomy, it's going to be about 6 to 8 weeks. This is when bone is removed and there's no fusion or instrumentation done. Okay. Now, looking at a spinal fusion, the time frame is typically 3 months. All right, and then adult scoliosis is a very lengthy rehabilitation, anywhere from 6 to 9 to 12 months. The objective is to truly feel comfortable with the decision you've made to have surgery, even if it doesn't produce the desired outcome. It's reasonable to work through these 5 considerations to make sure that it's the right thing for you. You want to be able to look at yourself in the mirror and say, even though I only got rid of half of my pain or whatever the outcome is, I tried everything possible non-operatively and it just didn't work. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurance plans, providing over 25 treatments with the board-certified award-winning doctors. Overall success rates average 90% plus. So visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.